My name is Michael Roberts. I'm a hospitalist here at East Alabama Medical Center, and I'm the current Chief of Staff. We've done several informational videos from East Alabama Health in the past, and we felt like it was time to do this again, considering the increase in virus in our area and our increase in hospitalizations. You know, when a new variant of the virus enters a community and people don't have immunity to that virus, then cases can increase rapidly. And particularly with this Delta variant, it's more infectious than the previous versions of the COVID-19 virus, and so it's caused a great number of infections in a short period of time. And that's what we're seeing now is rapid increase in the number of cases in our community, and subsequently rapid increase in hospitalizations. Yeah, so the Delta variant of the virus that causes COVID-19 is much more easily transmissible than previous versions of this virus. It's at least 50% more transmissible than the Alpha variant, which was itself more transmissible than the original virus that causes COVID-19. This is, appears to be for a couple of reasons. The Delta variant has a mutation that causes it to be replicated at a much higher rate when someone develops infection. It also is easier for that virus to enter the cells of a person that becomes infected, so that if you become exposed, you more easily develop infection and then more easily pass that infection on to other people around you. So what happens when somebody gets infected with this virus is that their respiratory cells begin to make copies of that virus. That's what a virus does. It causes its host to make more copies. So when an infection happens, millions of this virus are being created. And it's just making copy after copy after copy. And sometimes there are mistakes in that process. And usually what happens is that when there's a mistake in that process, it causes that virus to die. And that virus isn't able to then move on and infect other people, and it becomes less effective. But every now and then, that mistake actually causes the virus to be more easily transmissible, or to make more copies of itself once it infects the host. And so that's what happens with these variants, like the Delta variant, is there's been a mistake in the process as that virus is being copied that actually made it worse and more easily transmissible, to a point that it's now becoming the dominant strain of the virus worldwide. Yeah, I get asked a lot about breakthrough cases. We've been so fortunate at how effective the vaccine is at preventing symptomatic disease, but it's not 100%. It's never been 100%. We never expected it to be 100%. It's way better than what we could have ever dreamed, but it's still not 100%. And so some people who have been completely vaccinated may develop COVID-19. Now, what we've seen is that in general, those patients don't get as sick and don't end up in the hospital. But again, even at 95% effective, 95% is not 100%. And some people who have been vaccinated are going to get sick. Some of those people are people with compromised immune systems, or people whose immune systems aren't able to create an adequate response to a vaccination. And so even though they've been vaccinated, they are still at higher risk than somebody with a stronger immune system. And so, yes, we are seeing some breakthrough cases, particularly with this Delta variant. Yeah, I've been a proponent of the vaccine against COVID-19 from very early on, having been through what we went through last year, and seeing the severity of illness and watching people struggle to breathe and watching people die. You know, when I got my vaccine in December, I got my first vaccine. Just we had so much hope for what it might mean for us, and the ability to maybe prevent this. You know, even now, over 18 months into this, we still don't have great treatments for COVID-19. I still don't have anything that I can give you. If you come to me sick with COVID-19, I have some things that we can do that help some people some of the time, but I don't have anything that's 100%. And so prevention remains critical. And these vaccines, even the studies before they were approved for emergency use, showed that they were very effective at preventing symptomatic transmission of COVID-19. And we've seen that now in the real world over the course of this last 9 months with people being vaccinated. And so what I can say to you is that with hundreds of millions of doses of this vaccine now having been given, it is extremely safe. It is effective in preventing symptomatic disease from COVID-19, and it just may save your life or the life of someone around you. So our current recommendation is for vaccination of anyone over the age of 12. And if you have specific questions about your own risk with the vaccine and whether you should not receive it for some reason, I would encourage you to talk to your doctor about that. Yeah, we did a video back right when the vaccine was becoming available to try to address some of the questions about the safety of the vaccine and potential unknowns. You know, what might be out there? What could happen that we might just not know about yet? I think as time goes by, those unknowns are becoming smaller and smaller. We have seen a few adverse effects from the vaccine that we didn't know about right at the beginning. There is a very small increased risk of myocarditis in certain patient populations after administration of the mRNA vaccines. It's a very low risk and typically self-limited, but that's something that we found out. But as we get further and further out from the beginnings of our use of that vaccine, and as more and more patients have been vaccinated, there's very little we don't know about the effects of that vaccine. Because of the way that vaccines work, because of the vaccine itself is very short-lived inside the human body, most adverse effects from a virus are going to be very soon after that administration, within the first few days to a few weeks. We know from experience with other vaccines that anything beyond 6 weeks out from vaccination is exceedingly rare. And quite honestly, we don't expect to see anything like that with this vaccine. So we have this vaccine that we've been using for about 9 months, and it has an excellent safety profile, and it's very effective. And I understand that there's fear about what could be out there, but I think it's very, very unlikely. I think it's so unlikely that I've taken the vaccine, my wife has been vaccinated, both my children have been vaccinated. And I think we do have to weigh that against the known risk, the known danger from COVID-19, and that hasn't changed. It remains a deadly virus. Not for everybody, but for some, this virus is deadly, and we are still losing people to COVID-19. For others that don't die, they become very sick. They require oxygen. Some aren't able to come off of oxygen even when they've recovered. There are complications such as blood clots and strokes. There are a lot of really bad things that can happen as a result of COVID-19 infection. So given the choice between being infected with COVID-19 and having a vaccination, I will choose the vaccination 100% of the time. The vaccines that are available in the United States right now are available under what's called emergency use authorization. And emergency use authorization is something that the FDA utilizes in exactly that, in an emergency, in a health emergency, in order to get a potential therapy to market before it can complete the full FDA approval process. The FDA approval process is very rigorous and time-consuming for a reason. Nobody wants to send a therapy to market that is going to harm people, and so it's exhaustive, the process that the FDA goes through to give something FDA approval. The reason that the vaccines were given emergency use authorization is because of the severity of this pandemic and because of the tremendous loss of life that we have experienced as a result of that. Over 500,000 deaths in the first year of that infection, over 600,000 deaths in the United States alone from COVID-19. So the FDA has a process where a smaller amount of data can be reviewed in order to give a product this emergency use authorization. In the case of, say, the Pfizer vaccine, that was a trial that still included over 40,000 patients. And they were followed for at least 2 months after, which, to be honest, is the period of time that we would expect to see any adverse effects from the vaccine, generally in the first 6 weeks after a vaccine has been administered. And so they had this large number of patients who had received the vaccine, felt it had an excellent safety profile, had excellent results, over 90% effective in preventing symptomatic disease in patients who have been vaccinated. And so the emergency use authorization was granted for the vaccine. The FDA approval process is ongoing, and nobody can tell you exactly when that is going to be except for the FDA. They obviously have it as a high priority for that to meet all of the criteria, but they're going through their process, and hopefully sometime soon it will be approved, but I can't tell you exactly when that's going to be. It's frustrating. Imagine having some horrible problem that you can do something about if you can just do it in time, and having the tools and the tools not being utilized. Anybody in the United States can get a vaccine, can get it free, and we know it's effective, we know that it's safe, and we're just not using it. And so it's frustrating to then have another surge, and again, seeing patients coming in, having a hard time breathing, going on oxygen, going to the ICU, all of those things that we saw with each of the COVID waves last year, we're seeing it again. It makes everybody very anxious just to know what we've been through. We're seeing it again, and the cases are going up very rapidly, and we're frustrated and worried at the same time. All we want to see is an end to this thing, and I still think that the vaccine is our best way to get there. I've got no perfect treatment for it. Our best treatment is prevention. They say an ounce of prevention is worth a pound of cure, and it absolutely applies in this circumstance. I think that we have done a great disservice in this country by making this virus and this pandemic a political issue. COVID-19 doesn't care who you voted for. It is not Republican or Democrat, or it is not conservative or liberal. It is what it is, and it kills the conservative and liberal people alike. And I think that when you are making decisions about treatment, about vaccination, it can't be a political decision. We want to base our decisions on facts and on science, and I believe, based on my experience, based on my reading of the literature and information from sources that I trust, that vaccination against COVID-19 is our best way out of this. And it's the most effective management strategy that we have to get through this. I think it's very important that your information about COVID-19 and vaccination comes from trusted sources. And particularly when it comes to news media, some trust some sources, some others. The cynical part of me would tell you that they pretty much all have a spin. So I would get healthcare information from healthcare sources. If you're looking for local, I think we've been very consistent here at East Alabama Health about the information that we released. UAB has released excellent information regarding COVID-19 and vaccination. They've had several articles recently that I felt were very, very good from Dr. Michael Sag, Dr. Paul Gepfert. They're both very experienced in the field and give excellent information. Johns Hopkins, Mayo Clinic, recognized worldwide leaders in healthcare are giving good information. I think that the information from the CDC has been very good. I've been on their website. It gives very good information about COVID-19 and about vaccinations. And so I think that is also a good source for information. So I think it's critical that you get your healthcare information from a trusted healthcare source.